I'm often asked, how does the physics forcep work? Well, it's a very unique system, I call it magic, where you're putting pressure or tension on the tooth itself. It's different than a normal forcep where you're using a lot of physical force. You're really not using a lot of physical force. But we're putting pressure on the PDL, which creates a blood flow, and an increase in hyaluronidase acid, which breaks down the fibers, which allows the tooth to literally pop out of the socket. To demonstrate, here is a upper right physics forcep. Has a beak, which has a flattened, rounded tip, and a bumper. The bumper is disposable. It only fits on one way. And what we'll do is we will engage the pointer end onto the lingual surface of a tooth that we want to extract. The bumper will then be engaged as high up in the vestibule as possible, preferably by the mucogingival junction. Now, I'm going to use just 2 fingers here, and I'm simply rotating my wrist, no arm pressure, no forearm pressure, rotating my wrist, and it may take a minute or 2, and that's probably the hardest thing for dentists to understand, and the tooth will pop out. Concern that I've heard is breaking of the buccal bone with the physics forcep, and I don't find that to happen very often. Now, there's exception to every rule, obviously. The key to using the physics forcep is to use it properly, to be educated in its technique, work on patients. I know there's courses that are offered through physics to learn how to use the physics forceps properly, but you're not putting a lot of pressure. It's not like a normal forcep where you're putting a lot of pressure on the tooth. You're putting slight pressure, and there's no arm pressure or forearm pressure. It's really just rotation of the wrist. It's hard for many people to understand, but just simply rotating the wrist with very light pressure, and oftentimes I'll just hold it with a thumb and maybe 1 or 2 fingers and just rotate my wrist. If you can see how I'm just rotating my wrist. Now, it may take a minute or 2 for the tooth to pop out. If you use it like a normal forcep, certainly you can break the buccal plate as you would with a normal forcep. But with the physics forceps, using that light pressure and allowing the blood flow and the PDL to break apart really doesn't allow for the buccal plate to break at all. One question that we are often asked is, do we use our conventional techniques even when we're using the physics forceps? Meaning, do we break the PDL with a periotome, or do I have to elevate first using an elevator of some sort? And my answer is no, I don't use either of those when I'm using the physics forceps. I simply use the tool as I was trained to use, rotate my wrist, and that breaks the PDL in itself. Holding the forcep, we don't put a lot of pressure on it, and when I'm teaching the use of physics forcep or trying to explain the use of it, I'll tell doctors I hold it with such light pressure that you could literally pull it out of my hand if you jerked it away from me. So there's not a lot of force on it. So it's maybe like holding a glass of water, holding a glass of wine. You're not squeezing it, you're just kind of holding it. When you're using the technique of the physics forceps, we are, as we've mentioned before, putting rotational pressure and tension on the PDL, which is breaking down, and eventually the tooth will move. You have to take your time. It may take a minute or 2 or even longer on some roots. And as you're rotating your wrist, you will actually feel the PDL pop. It will literally pop. Now, at that point, you can stop using the physics forcep because the PDL is pretty much disturbed. And what I will often do is take a forcep or a needle nose a forcep or pliers and grab onto the tooth and then just simply rotate it out. You don't want to necessarily keep rotating, say, a cuspid tooth, because you potentially could do damage to the tissue or tear the tissue or maybe even the bone. I've heard doctors say that they are concerned with bruising in the area of the mouth where the bumper was placed using the physics forcep. And I can tell you that I don't really experience that. If you're getting bruising or tearing of tissue or breaking of the buccal plate, you're using too much pressure. I'm literally using a finger or two and a thumb and rotating my wrist. I'm not squeezing the forceps, so you're not putting a lot of pressure on the tissue. So getting bruising of that tissue on the facial aspect should not happen. Also, maybe the position of the mental nerve. Are you going to bruise the mental nerve? Well, again, the same answer. You're not squeezing the forcep. You're not squeezing the tissue or the bone. You're simply rotating the wrist to elevate the tooth out of the socket. So that really should not be a concern. Another question that's often asked is, what about the patient response to physics forceps? Well, patient response is just remarkable. I can't tell you, and we've all heard this about putting a knee on the chest and getting a tooth out and the bad experiences. I've never seen that in all my years of practice. But the physics forceps is a very, very atraumatic extraction for patients. Patients are amazed how simple the procedure goes. They may feel a little pressure, but nothing like a typical or conventional extraction with conventional forceps. I know in the old days we would take an elevator and just elevate, and not really use forceps. Well, it's a similar technique or similar experience for the patients. When you're not using all that force, that muscular force on the patient, they really respond very, very well. We don't damage the buccal plate. We have good socket preservation, and therefore excellent healing. And the post-operative complications are minimal. It is an extraction. You're tearing the PDL, but I think my patient's responses has been remarkable. The question that is often asked is, what about divergent rooted teeth or molar teeth or badly decayed teeth or endodontically treated teeth? Can you use the physics forcep? And my answer is absolutely yes. Oftentimes I'll take a surgical burr, even a carbide or a diamond, and I'll flatten out the lingual surface of the tooth so that you do have a purchase point for the beak. But it's the same simple rotation. Endodontically treated teeth, badly decayed teeth will rotate out without a problem. The only teeth that may cause a difficulty is those teeth that are ankylosed, and those are just going to be difficult situations for us to deal with as practitioners anyways. But the physics forceps certainly can be used in most situations. Now, if you do have a molar tooth that has divergent roots, what you may want to do is simply section it at the furcation and take it out as two separate teeth. Maxillary molar teeth, the bone is usually pretty soft up there, and I have pretty good luck taking those out in one total tooth. The other question is, what if you have decay underneath an existing crown? Well, sometimes you should take the crown off first, or it will come off first, but you're really engaging in the sulcular area of the tooth on the lingual or palatal aspect, so you're not really engaging the crown. But sometimes if you have a badly decayed tooth under a crown, the crown may come off first, and then go ahead and use your standard techniques using the physics forceps. They come packaged. They're latex free. They're one unit dose. You could sterilize them, but you really don't want to if you don't have to, and they simply pop out of the package.